Now, we've talked about the mechanism of pulmonary ventilation theoretically. Now we are going to talk about it and package it in a physiological way that involves mechanical movements of different parts of the body that are involved in what? Pulmonary ventilation. And on doing this, we are going to group all the three ways we talked about before, which are the exchange of air between the external atmospheric air and the external respiratory pathway or the conductive pathway. We are going down to the alveoli of the lungs, as we said, into two. Number one is inspiration. I put in bracket, taking in. It's the process. Number two, expiration. Taking out, or pulling out, or taking out. Let me put it, taking out. Good. These are the two basic mechanisms of pulmonary ventilation. These are the two basic mechanisms of pulmonary ventilation anywhere, anytime in the world. Inspiration and expiration. Now we're going to talk about in-depthly what inspiration and expiration means. Don't forget, imagine yourself sitting in front of your teacher during your model control, so you have to package everything and put it accordingly as fast as possible. Now, let's go quickly. What is inspiration? As we said, taking in of what? Air. What and what are involved in inspiration? Very good. Now, for you to inspire air, there are certain things that are involved. First of all, if you ask the question, what is the most important muscle that is involved in respiration? Of course, you should know that one should be at the tip of your fingers. Of course, diaphragm. So the first important structure that is involved in inspiration is the diaphragm. Thank you. Diaphragm. Two, what again is involved in inspiration? I just inspired now. You could see some movement. Very important. What happens? Of course, external intercostal muscles. External intercostal muscles. Intercostal muscles. External intercostal muscles. And also, what again do we need for inspiration? Or what are the structures that are needed for pulmonary ventilation? Of course, you will need the lungs. If the lungs is not there, what else are you using for ventilation? Lungs is there, and the pleura of the lungs. The pleura of the lungs. And of course, the muscles we are talking about are attached to what? Those skeletons. So of course, the ribs are very important. All these are very vital for breathing at rest when there is no active movement. When you are not doing, example, exercise or something like that, or something related to that. These are what you need for normal inspiration or normal breathing. These are what you need without, when you are not doing any form of what? Physical work. Very good. Now, we are going to talk in-depthly the functions of all these muscles individually. Now, particularly for inspiration, what happens? Let me quickly draw a diagram. This is going to be your sternum. I'm very good in drawing, seriously. If you see my diagram, you're going to be blessed. Oh my God, I said it. So, you're going to be seeing some blessed diagrams. Good. Let's take this to be our ribs, external intercostal muscles, and our diaphragm. Of course, diaphragm separates what and what? Thoracic cavity from the what? Abdominal cavity. And let's say our lungs is here. Our lungs is here. Very good. Very good. This is our lung, and this is what? The diaphragm. What happens during inspiration? Good. Before I get to that, let us again lay a very good foundation. Air or gases moves according to gradient. Pressure gradient moves according to what? Gradient. What is gradient? Differential pressure. Due to what? Differential pressure. One must be higher than the other. The one that is lower, if this chair is lower now and I am higher, what happened? I'm coming down to the what? Chair. Very good. If I have a whole lot of money with me, and for example, if I see somebody on the road that is in need of help, what happens? I give to the person. So what happens? That is exactly the principle that is obtainable in what? Gaseous exchange. Pressure gradient. When the pressure that is in the atmospheric air is higher than the one in the lungs, due to that gradient, air moves from the external environment into the what? Lungs. But when the pressure in the lungs is higher than that in the atmospheric, or higher than that in the atmosphere or in the atmospheric air, what happens? Air moves, or gases moves from the lungs to the external environment. Let me take it very closely again. Now, pressure gradient is what we're talking about. When the pressure in the atmospheric air is higher than the one in the lungs, air moves from the what? Atmosphere into the lungs. But when the one in the lungs is higher than the atmospheric air moves from the what? Lungs to the atmosphere. Very good. Beautiful. Now, what happens during inspiration? The what? The diaphragm contracts. As the diaphragm contracts, what happens? It pulls downwards. As it pulls downward, what happens? It increases the pressure in the what? Abdominal cavity. As the diaphragm contracts, what happens also? External intercostal muscle. External intercostal muscle what? Contract. As it contracts, it pulls the rib cage upwards. And we know that the structure of the rib cage, of the rib, we know posteriorly the rib is attached to the what? Vertebral column. And anteriorly to the what? Sternum through its what? Cartilages. And it has a kind of shape like this, whereby the posterior attachment looks a little bit higher than the what? Anterior attachment to the what? Rib. And on the sides, what happens on the side is a little bit curved. So when it pulls upward, it will kind of have a movement like this. And when something was like this and it moves like this, you could see that there's increase in the what? Diameter. We increase diameter. It's a kind of what we call what? Bucket handle movement. Just like when you have a bucket like this, and the handle was here. The handle was here. And I have some handle like this. Now, when you try to pull the bucket upward, what happens? You see something like this, because you are trying to lift it up. You see something like this. Pull it up, and you see something like this. What happened? You've increased the diameter. You've increased the diameter. So that is the same thing that happens in the lungs. So as the external intercostal muscle contracts, it pulls the rib cage upwards. It pulls the rib cage upwards. It pulls the rib cage upwards. So what happens? As it pulls the rib cage upwards, it what? Increases the size of the thoracic cavity. As it increases the size of the thoracic cavity, we all know that the pleura is divided into two. parietal, the one that attaches to the thoracic wall, and what? Viscera pleura. Viscera, of course, viscera, when you have viscera, means organ. So the one that what covers the lungs is called viscera pleura. And in between them we have what? Pleural space or pleural cavity. Now we also have the what? Lungs cavity or pulmonary cavity. So when this space is improved, when the space in the thoracic cavity increases, what happens? The pressure that was originally in the pleural space does what? Reduces. Why? Because when there is increase in the thoracic cavity, there will be what? Reduction of what? Pressure in the lungs. Due to the increase of size of the lungs, there will be reduction of the pressure. And the pressure originally that was increased in the what? Pleural space will be reduced. Because if you have something like this is pleural space, this is pleural space, this is parietal pleura. Now this is the lungs that the parietal pleura covers. So if the lung increases in size, what happens? Of course, there is a tendency that this will come this way. Therefore, this space is reduced, pressure is reduced, and what? Pressure inside the pressure inside the lungs is what? Reduced. When you have a lot of space in your house, you could see that you won't be packing things together again. You have a lot of space to arrange. So that the pressure of arrangement, of thinking of how to arrange, will be what? Reduced. Same thing that happens in the lungs. When the lungs increase due to increase in thoracic cavity, the pressure what? Reduces. And this pressure that reduces is of very, very important or physiological, is of a very good physiological importance to us. What happens? What is the physiological importance of that what? Pressure that reduces? It will allow for what? A fresh intake of air due to pressure created from the external environment. And that will what? Allow us to renew our blood gases, which we said in our definition of what we call what? Breathing. That is inspiration. Did you get it? Let me recap it very fast as possible. Very fast. Diaphragm contracts, reduces the pressure in the abdominal cavity, increases the pressure in the abdominal cavity, reduces the pressure in thoracic cavity. External intercostal muscle contract, pulls the rib forward and enlarges the thoracic cavity, thereby increases the size of the lung. The pressure in between the visceral pleura and the parietal pleura reduces, pressure in the lung reduces. Due to pressure gradient, air is what? Inspired down into the what? Lungs. That is the first mechanism of pulmonary ventilation. Second mechanism, very, very easy because it's the direct opposite of what? Inspiration. What happens? Diaphragm relaxes. Diaphragm what? Relaxes. As diaphragm relaxes, goes back to its normal position, relaxes. What happens? External intercostal muscle also what? Relaxes. As they relax, what happens? The pressure that was here before, that was increased in the abdominal cavity, will be pushed up, and due to that, and also the pressure that was between the viscera and the parietal pleura would what? Increased. First of all, it was reduced. It was increased. That pressure would increase, and what will happen again? There will increase the pressure in what? Pulmonary cavity. Increase in pressure in what? Thoracic cavity, thereby allowing, due to pressure gradient, movement of